Hi, good morning, everyone. I'm Dr. Emma Chan from Taiwan. Today, I'm going to discuss the topic of Moya disease. And just to get the overview, what we are going to talk about, I will be presenting a case as well as a general idea of this disease, including the introduction, terminology, epidemiology, and a little bit about the pathophysiology and what kind of symptoms the patient may present, and also the differential diagnosis and the most important diagnosis tests and the further management. So firstly, the case. This is a 30-year-old African-American female presenting with a piercing headache, piercing type of the moderate intensity headache, which was on and off for, let's say, several months. And her pain was not relieved by any over-the-counter pain medication, pain relief medication. And also she complained about the weakness of the right hand, as well as a little bit of dizziness and difficulty speaking. There was no associated fever, night sweat, loss of consciousness, vomiting, ataxia, photophobia, and she denied any tingling or numbness, difficulty swallowing, difficulty hearing, neck stiffness, and any visual problems. So the vital signs here, we can see that she is a moderate obese with a BMI of 36. Her vital signs were generally stable with slightly hypertension. Blood pressure is 165/75, and temperature and respiratory rate are normal. So, so her neurological examination showed that So her neurological examination showed the normal cranial nerve function. Motor strengths are grossly normal too, with like right hand side. Her right side of the hand is weakness. The strength is 3 out of 5. No pronotal drift was noted, and her muscular tone and gait was normal too. And other tests include laboratory data, CDC, CBC, DC, EEG, EKG were all normal. However, her CT angio of the head showed proliferation of collateral vessels from the distal internal carotid artery, particularly on the left side. In addition, there were distal internal carotid artery and one segment of the left side NCA appear somehow a little bit decreased in caliber. So basically, her findings were generally compatible with, Her findings were generally compatible with the Moya disease. Since the patient was refractory to the pain medication, surgical procedure involved the left superficial temporal artery and left medial cerebral artery bypass was done without any complication. Then she was followed up by every 6 months for next 4 years. And since then, she didn't complain any of the headache or any focal neurological symptoms. So right now I'm going to introduce a little bit about Moya disease. It is actually a unique cerebrovascular disease characterized by 2 main factors. The first one is progressed large intracranial artery narrowing. And due to this stenosis and occlusion of the large artery, the compensatory small vessel collaterals then would develop. And Moya disease was firstly described in Japan in 1957. And most of the cases happen in East Asian ethnicities. And interestingly, Nan, the Moya Nan is actually a Japanese word meaning a puff of smoke in the air. So here you can see. Then we're going to the terminologies. 3 things that we need to know in the beginning. So what do we mean when we say Moya? It actually, it's kind of when we say Moya in the clinical setting, it actually describes the specific angiographic findings of unilateral or bilateral stenosis or occlusions of the artery around the circle of Willi, such as NCA, ACA, and also with a prominent collateral circulation. And just for reference for you guys, like when sometimes we use an air bronchogram to describe some chest X-ray finding. I think this is very similar term because it's all describe the radiology finding. So Moya is a term that describes the specific angiographic finding. So what is Moya disease? And Moya disease refers to a patient with Moya angiographic findings who may have a genetic problems, but without any associated conditions. So they may also be called by primary or idiopathic Moya disease. So what is the differences between Moya disease and Moya syndrome? Moya syndromes are the patient with Moya angiographic findings, but they also have associated medical conditions such as atherosclerosis, radiation therapy. The patient may did the radiotherapy on their brain before and vasculitis, or the patient may have the underlying metabolic disease. And those associated medical conditions would then induce a MOMA syndromes in the future. So that's why this is the two differences. So just to sum up, the Moya disease is a primary disease. However, the Moya syndromes are developed due to the patient's underlying associated medical issues. So, so here we can see a very typical photo with Moya disease. This is actually a digital subtraction angiogram. To be honest, we don't really use DSA that often in Taiwan because it is invasive and it gradually get replaced by CTA and NRA. They are also sensitive but non-invasive. But like this is a very typical picture that we can see. This is a stenosis of the NCA, and here is the collateral vessel parts. So you can see this is a collateral vessels, which look very similar to the puff of the smoke in the air. Okay, so about the epidemiology, Moya is a disease for a young population with a bimodal age distribution. The first peak is around 4-year-old, and the second peak is around 30 to 40 years old. And most cases happened on children. And most noticeably, there is a female predominance in this disease with a female to male ratio around 1.9. And also 10 to 12% of the patient will show a strong family history of Moya. As for the etiology and pathophysiology, the true etiology of the Moya is still unknown, but genetic association have been identified. The most famous gene is NF213 on chromosome 17. And there are some associated conditions that I mentioned before would induce Moya syndrome, such as head trauma, brain tumors, meningitis, viral and bacterial infection, or cardiovascular disease. Additionally, some research indicated that elevated angiogenesis-related factors would be found on some Moya syndrome, Moya disease patients, such as VEGF and fibroblast growth factor. So what kind of symptoms of the patient, what kind of symptoms that the patient would present when they have Moya? The most common initial presentation of Moya is ischemia stroke, and TIA is also very common. And so in children, symptomatic ischemia of ACA and MCA is territorial infarction may be triggered by exercise, crying, coughing, and hyperventilation. And also, the ICH is a very common initial presentation too. And according to some research, ICH happened more often for patients in China and Taiwan than in the United States. Also, some children may present seizure as the initial presentation as well. So there's a wide variety of the clinical presentation of Moya disease. Patient might have the symptoms such as a stroke, but they may have TIA or seizure or ICH. So it's kind of critical for us to know how to differential diagnosis. And as for differential diagnosis, we need to keep these following disease in mind, because before we diagnose a patient with primary Moya disease, we need to exclude all these following disease, such as whether the patient did a cranial radiotherapy before, or he or she has atherosclerosis, or is there any infection of the brain, or neurofibromatosis type 1, or tuberculosis sclerosis, connective tissue disorder, and any kind of hematological disorder, such as sickle cell or antiphospholipid syndrome. So when patient present with the stroke or the seizure, normally we would just order CT or NRI or EEG for the initial test. But what kind of findings in the NRI may imply that the patients have a Moya disease? So the first of all is dilated collateral vessel in the basal ganglia or thalamus. So here we can see this arrow, it shows multiple punctured flow. This is highly suggests that the patient probably have the Moya disease. And the IV side is very important too. 80% of the patient who have Moya disease may show IV side on NRI. So IV side refer to a focal tubular hyperintensity on flare as a kind of NRI, a flare or T1 image of the NRI. So we can take a look of this picture. This is the IV side flare image of the NRI. You can see it's kind of dark, but you probably can see this is a hyper-intense linear lesion. So this is IV side, and here is a curvy lesion too. So this is a very typical sign for Moya patient. Okay, so let's go to the diagnosis. So what is the gold standard diagnosis tool? It's not NI, it's actually the angiography. It's a CTA or NIA. Like I said before, like DSA may be used before too, but right now it get replaced by NIA CTA for most of the medical center. And we can take a look of this video.
Hi, I'm Dr. Andrew Dixon from radiopedia.org, and in this video we're going to look at the puff of smoke sign, which is an angiographic feature of Moya disease. Here are lateral images from a vertebral artery injection, and we can see that emanating away from the basilar there is a fine irregular network of curly vessels simulating the appearance of smoke. On these AP angiographic images from an internal carotid artery injection, we can better appreciate the primary abnormality in Moya disease, severe narrowing of the circle of Willis vessels. It is this narrowing that results in the development of the collaterals perforating through the basal ganglia to supply blood to the rest of the brain. These corresponding MR angiogram images demonstrate nicely how these vessels perforate into the brain substance. So a pretty cool little sign, that one, the puff of smoke sign in Moya disease. You can find out more on.
Okay, so yeah, so he actually explained the puff of smoke in the air side very clearly. Therefore, we can conclude that angiography is the most important part of the diagnosis. The image just says everything. So when we diagnose this, we really need the image to just back up to support our theory, our diagnosis. And yeah, just to conclude what I just said, the diagnosis of Moya disease is met by identifying the angiographic appearance of the bilateral stenosis affecting the distal internal carotid artery and proximal circles of the Willis vessel. And however, and also with the presence of the prominent collateral vessels. And however, although the traditional criteria is a bilateral stenosis, right now, like they find out actually the unilateral, 40% of unilateral stenosis patient may have a Moya disease too. So you cannot always exclude the unilateral stenosis patient out of the Moya disease. And so for the diagnosis of the Moya disease, underlying associated conditions definitely need to be excluded. That's what I told before, like atherosclerosis, and if the patient have sickle cell disease or if the patient have NF type 1, then they should be excluded because Moya disease is a primary disease. It's not due to the secondary condition. So right now we're going to say, like, if the patient present to you and with a Moya disease, like when was the perfect time to order a vascular image? Because you cannot just order a vascular image to everyone who present the stroke or seizure. So according to UpToDate, they say like children or young adults with repeated symptoms of ischemia attacks, or the patient who lack risk factors of the ICH, but they present with the ICH in Brand's region supplied by small vessel. In these two conditions, we need to suspect whether they have a Moya disease. And okay, so So this is a very interesting photo. The left side is a non-contrast CT with an intravascular hemorrhage that you can see the blood is here. So this patient actually has a Moya disease. You can see that the stenosis in the right NCA here. And then after this stage, the collateral vessel just developed because the stenosis, the blood flow cannot go through here. So there's a collateral vessel try to supply the brain in this area. So next step, when are we going to do screening? In general, it is not necessary to screen a symptomatic individual. However, a non-invasive angiogram may be helpful and reasonable in patients with a strong family history, especially for the East Asian ethnicities such as Japanese, Korean, Taiwan. Finally, we're going to the treatment. So acute management for patients with Moya disease who present ischemia symptoms, the treatment is actually kind of similar to the stroke treatment, such as reduce intracranial pressure, try to improve a little bit blood flow in the brain, and also control the seizure. Another thing that we need to be careful is that try to avoid children to cry and hyperventilation, because hyperventilation may induce vasoconstriction. So that's why we try to avoid this. And for hemorrhagic stroke patients, the hematoma removal is it's often required. And so there is some research show that for children and adults with asymptomatic or symptomatic ischemia, Moya disease or Moya syndrome, long-term therapy with aspirin or cilostazol was suggested than doing nothing, because this is the patient with aspirin and cilostazol have a better prognosis. And so there is no curative treatment for primary Moya disease. However, we can do the surgery to prevent patient to get a secondary attack. The most common one is direct revascularization. They actually just do an anastomosis between the superficial temporal artery to middle cerebral artery. And so the blood can flow from the superficial temporal artery to the MCA to supply the whole brain. And that's it. This is my reference. And thank you for your attention. Any questions?